The argument that we need to educate providers more is an argument that could always be made. Who could not benefit from more education? The question is the problems that we are facing resulting from a specific lack of information or a specific lack of certain types of information? And that's not clear to me. I think that when you look at the issues of drug diversion, you may have a patient that's been provided an opioid by a responsible provider for a patient who's low risk, has a reasonable and appropriate indication, has been monitored with their urine drug testing and their state's PDMP programs. You can do all of the right things for a patient, but if it's sitting in their medicine cabinet in an insecure manner and somebody were to dip into that, all of that is for naught. So you can educate the provider all you want, but if the medication is diverted, that education is not going to result in a reduction in the harms, unless it's an educational piece around diversion. Well, diversion takes a couple of things. You have to make them less accessible, you have to have insurance companies willing to support smaller prescriptions, you have to incorporate technology like the abuse-deterrent formulations, you have to have lockable containers. There are many things that I think could help on the diversion side. But to blanket this and say that our providers in this country need more education as the solution, I would really argue, well, what is it you're trying to fix? I think of it like if a plane were to crash, you could say, well, gosh, pilots need to go through another 2,000 hours of flight training. Well, if the problem was a bad screw, the education isn't going to fix the negative outcome. And I think we have to be very tied between our problem and our solutions and make sure that those are intimately linked, not just come up with solutions that we think are good ideas or that are good sound bites. This is a complex problem, the solutions are going to be complicated, and what fixes one problem won't fix another. There's not a one-size-fits-all result or approach that's going to be successful. I think diversion is really the area we have the greatest potential for impact. When you have the majority of people that are using opioids that are once prescribable, because now certainly we have an influx of opioids which are not prescribable, but if they were prescribed, I think that an educational piece, and we do this in our practice, and we specifically set aside time to talk to our patients about how they store their medicine. We say that the most common ways that people will get these drugs in their possession to abuse is through diversion. Sometimes people willfully divert their drugs, and sometimes they unknowingly divert their drugs. So part of their responsibility as a patient is to make sure that these medications are kept in a secure manner. And we say, has anybody ever talked to you about how you should store these medications? I mean, you've had somebody prescribe them before, you've had a pharmacist dispense them to you. Has that ever come up? I have yet to find a patient who will tell me that somebody has talked to them about how they store their medicines. And that's a pretty simple intervention about patient education that I think is very much lacking. So I would say, if nothing else, talk to them. Tell them to store it like they would a loaded handgun. If most people on the street you stopped and said, how should a loaded handgun be stored in a home, especially if there's children in the home? Most people would say they've heard the message that, well, it should be locked. You talk about medication, that message is not out there.